Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda.
David, you missed your calling as an opera singer. This is the Feeling Good podcast for all your listeners from all over the world and universe. This is episode 496, and we have an interesting subject and our beloved Matt May to join us. Hi, Matt.
Hey, Rhonda. Hey, David. Great to see you both.
Likewise, absolutely. Every time you join us, it's a joy.
For me as well.
So, David, do you want to explain what we're going to be talking about today?
I will let Matt explain it, since It's a topic that Matt brought to us, but it's one that everyone can relate to, therapist and patient alike. And Matt's focus will be on why therapists have trouble using I feel statements. But we can also branch over into why you, the listener, maybe you're not a therapist, but you may find that you hide your feelings and you don't want to open up and share them openly.
Right. Yeah, this topic came up, and I emailed you about it, David. I got kind of excited when one of my students asked a question, and their question was, is it okay as a therapist to say, I feel scared? And I thought about
to their patient or to their client.
To their patient, yeah, to their patient, right. And I thought back, I had an experience early in my practice. I had a fascinating and unusual case, someone with what we called conversion disorder at that time. I think it's now functional somatic disorder. And they were in she was in a wheelchair and couldn't walk, had what seemed like a neurological problem. But when she would go to neurologists, they would test her muscles and her reflexes, and they would send electrical currents and things like that. And they concluded that there was nothing wrong with her nervous system or her muscles.
Wow.
And so she heard that a couple of times and agreed to see me. As a psychiatrist, and I was trained in hypnosis, and hypnosis is often used to treat conversion disorder. It's one way of thinking about it is that when people have a very upsetting emotion that's getting swept under the rug, and we call it the hidden emotion in the team model, and it gets expressed in some other way. And in this case, it got expressed as her not being able to walk. And she was one of the sweetest women I'd ever met. I worked with her for a while, and I was struggling to figure out exactly what her hidden emotion was. And she mentioned something about her husband, and I said, oh, well, maybe we could have him come in and talk together, and because he knows you well, and maybe he'd have some ideas about what's going on. So he came in, and we had a conversation for a bit, and I don't remember exactly what it was that set him off, but he suddenly got really quite angry. And
let's see, is that something that set off her husband?
Something set off her husband. Her husband
in the session, you mean, or at home?
In the session.
Oh, he came in and joined the session and got very angry.
Correct. Yeah. So we're all three of us are in my office, and we're talking things over, and suddenly he's getting heated and angry, And I start to offer what I thought was really excellent empathy. And I acknowledged that he must be feeling angry and upset and scared, and I wanted to hear more about it. And I could see some truth in what he was saying, why he might be upset. And I thought I was doing everything right, but he got more angry and more angry. And eventually he was red in the face and he was pounding on the armrest of the chair in the office. I thought he was going to break it. In fact, I think he did break one of the armrests in that chair.
Wow.
And I was like, what am I missing here? And I realized I hadn't done an I feel statement. And so I said, oh, gosh, I'm starting to feel kind of scared right now. And the transformation was immediate. He just calmed right down, and all his anger melted. And because I think he started to realize that he was, in fact, kind of scary, and he was scaring me. And then I got it. It kind of clicked for me. I could see what was going on is that probably she was feeling a lot of the same things, but wasn't telling him that she was feeling scared. But instead, she was literally paralyzed with fear and didn't know how to talk about it and how to communicate that. And so that was one of the moments in my life where I think talking about my feelings was very powerful, very healing, and I think maybe protected me, saved me from a physical altercation. And so when my student asked that question, I thought, oh, this is important. And for folks to know, this is a big part of their power. And it's paradoxical because it feels so vulnerable to talk about our emotions and to let people in. And yet it's very powerful at the same time. And then I started to kind of wonder about why is it that therapists have this idea that they're not supposed to talk about their feelings. And I think there's some history behind that, probably going back to Freud and the analytic model where the therapist is supposed to be like a blank screen, analyzing the emotions of the patient in a dispassionate way, rather than being present in the room talking about their feelings. And I think those old ideas can kind of linger in terms of our thinking about how we're supposed to be as therapists. But I'm working with my students these days to empower them so that they can express their feelings in a way that is appropriate and helpful, not in an oversharing kind of way that burdens their patient, but in a way that can heal them and bring folks together. And so I thought I'd just share that with you guys, and maybe we can riff on it a little bit as a topic.
What an incredible story, Matt. That saying that you were scared had an immediate shift in your patient's
it was like
husband's demeanor.
Yeah, it was almost like he'd been hit by a tranquilizer or something. He just settled right down and was very easy to talk to after that.
And then did your patient, how did she respond?
I think, she didn't have much of a response in that moment. We had to kind of process it afterwards and talk about the parallel process that was happening there between me and him, and the same dynamic with her and him.
And then through processing that, was she more aware of her fear?
Right.
And
could talk about it, and she didn't have to hide her emotion anymore, and it helped her recover.
Wow.
Was her walking away symbolic of being afraid of him and wanting to get out of the room? And
yeah, right. There's always a kind of communication of the hidden emotion there. She was, I think, afraid to leave, afraid to move, afraid to express her feelings, it kind of helped him have more sympathy for her and to understand that there was something going on that wasn't right. It was a little bit of a cry for help.
Mm-hmm. And then, Matt, you said something that sharing our feelings, being vulnerable is a source of our power. Maybe I got that wrong. Could you explain that more?
Sure. Yeah. Well, I can share kind of what David taught me earlier when one day someone was talking about setting boundaries, and David explained that he doesn't like that idea of setting boundaries because if you set up a boundary and you say you're not allowed to do this thing, then people want to do it even more. It's like they'll kind of rebel against it. You put up a wall and they'll just want to break it down. But if you let people know that what they're doing is hurtful to you, and it's upsetting and it's painful, and you let them know that you're human and you have these feelings and you're bleeding and hurting too, that's when they start to see you as a human and understand what they're doing and have more compassion. And so they set the boundary for themselves. They don't want to, for most people, they don't want to continue to hurt someone. And then that triggers also an opportunity for them to talk about their feelings. If the therapist models self-expression and healthy self-disclosure, then the patient realizes, oh, I can do that too. And so the power is kind of spread to the patient as they learn to talk about their feelings and let others know when they've been hurt.
What are some kinds of feelings that therapists can express with I feel statements, and if done skillfully, can enhance the therapeutic relationship? And what are some of the kind of feelings that a therapist actually should not express?
That's a great question, David. I'll maybe see what Rhonda thinks about that. I have a few different thoughts on it.
Well, you talk often, David, about how therapists are reluctant or afraid to talk about anger. Maybe that's because therapists are inherently codependent and want to avoid conflict. So that's one thing. The second thing is when sharing feelings like I'm feeling controlled or I'm feeling manipulated, that's kind of a blaming type of a feeling where it's implying that somebody's action or behavior is affecting us rather than talking about our own true internal emotion.
Yes. And so if you say I'm feeling controlled, then the other person is likely to get angrier, and thus giving it a self-fulfilling prophecy that expressing your feelings isn't a good idea.
Right.
So it's not so much whether or not you do, but the way that you do it. So
right.
how would you express I'm feeling controlled? Can I take a shot at it?
Sure.
I'm feeling fucking controlled, so shut up.
Well, I think it would be saying I'm feeling sad or scared or confused or angry or irritated or those heart-based, I don't know if you would call them that or what you'd call them, feelings.
Yeah. Mm-hmm. And when you express your feelings, what is the immediate sign that you suddenly have to stop expressing your feelings and go into the listening skills, disarming, inquiry, feeling empathy, and so forth?
It's important to pay attention to the person you're speaking to, their body language, their facial expressions, whether they've started to cry themselves or they're reacting to what you're saying. And then they might start sharing their feelings. Putting this in context, we're talking about one step in the 5 secrets of effective communication. Yeah. You might need to go back to the beginning and start all over with another disarm statement.
Yeah. What I was pulling for there is that people, they read books on assertiveness and things like this, and they make it seem simple, like a step-by-step thing. And if the other person is, being mean to you, you can say X, Y, and Z, and then you expect a good result from them. and you probably won't get a good result from them. And so sometimes you have to do really good listening before you can share your feelings and hope that they'll listen to you. You have to give what you want to receive.
Well, maybe then we should put this into context. Where does the I feel statement fit in the universe of communication?
Just, about a half a centimeter from the midline on the left.
Well, I can share a little bit on that. So what I've noticed is that one common pattern is when there's a little resistance in the therapy, and the patient might not be doing their homework, or in some cases, or like recently there was a conversation about a patient who had love addiction, and even though the person they were in love with was treating them really badly, they kept on chasing after them and trying to get them back, and really suffering tremendous heartbreak as a result of that. And the therapist was getting upset with them and angry with them that they kept doing this to themselves. They were watching their patient interact in a way that was just kind of demeaning to them, and their chasing was just forcing the other person further and further away, and they were getting more and more heartbroken and treated worse and worse by that person. And so the therapist was getting angry with them that they continued to do that, but they weren't telling their patient that they were feeling angry about it. And then we practiced a little bit of how you can communicate that feeling with your patient when you combine all of the 5 secrets. And you talk about how this is an awkward feeling to express because, we just have so much admiration and respect for them. And at the same time, we see them doing things that are really hurtful to them. And we like them and we care about them. And if someone else were forcing them to act this way and do these things that are hurting them, we would be angry with that other person. And it's awkward because they're the one doing it to themselves, and we feel angry with them, and it's such an awkward feeling to express. But we wanted to be open with them about it and wonder how they're feeling when they hear that, and that sometimes turns things around.
Should we try role playing one of these scenarios to bring it to life for people?
I'd love that. Yeah, that sounds great. David, you brought up a very challenging one when one time a patient you had seen who smelled like urine and would talk about how he wanted to rape women. Is that right?
Yeah.
It was really awkward for you, and then the thing that you would say is, well, you can say anything to anyone at any time, as long as you do so with admiration and respect.
Yeah, right. And the problem is when you get pissed off at someone, you don't want to treat them with admiration and respect. You want to put them down and treat them in a hostile way and hurt their feelings and so forth. And if we were to ask our listeners, how many of you really enjoy putting other people down? How many would say yes? What percentage?
If they're being honest about it, I think most people would say that it's kind of fun to put people down and feel superior at that level.
Absolutely. Yeah. So let's see if we can get into a...
Do you think that's cynical, really?
Or I could tell that story. What is it?
Do you think that's cynical that everyone would say yes? I had the opposite, that everyone would say no. I don't enjoy putting people down. I don't want to hurt someone's feelings.
Yeah. Well, that's what I was driving at, that there's a tendency to deny that part. And Jung's therapy was based on that, or that we don't want to look at our shadow, and we want to imagine we're the pure one, and everyone else these are the people with with aggressive feelings. And, for me personally, I have found it liberating just to accept the fact that I can get pretty pissed off at people at times, and that I'm not always, super nice or a super model of whatever people want me to be, and that I don't have to keep, trying so hard. But I mean, we could set up a little brief exchange, or I could repeat that story of that patient. He was someone I was really angry with, and I just didn't like him at all, and I had to tell him, I don't like you, and I wish you'd drop out of therapy. And every time you show up, I'm hugely disappointed. That's the story. And this was a fellow who lived with his parents. He drank heavily, drank a lot of beer, I guess, and he came to sessions smelling of urine. So it seemed like he was, peeing in his pants a lot. And I had nice cloth furniture for my patients to sit on, and so after he'd leave, the smell would linger for up to a week in the room. And other patients could clearly smell it, and then all of a sudden it would be just about cleared out, and then he'd come in for his next session. And also, he came. His parents thought he was kind of lonely and didn't have any friends. And during sessions, he just talked about how it would be really cool if he and I could go out evenings raping women. And that was just disgusting to me as well. I don't believe he was doing that, but it was kind of like where his fantasies were. And I told myself, David, you've got to express these negative feelings to him, or something bad is going to happen. That's my rule in therapy. If I have negative feelings about a patient, I have to express them right away and try to do it in a kindly way. And so the way I did it, should I just demonstrate it, or?
Yes.
Yeah, I think people will be kind of blown away by it. And you could even ask them to pause and think, how would they say it?
Yeah, like how would you explain it? That's a good one. Take a piece of paper and write it down. How would you tell this patient you can't stand him and you wish he'd drop out of therapy?
Yeah, and you're disgusted with him.
And you have to do it in a way that really flatters him and makes him feel like $1 million. That's the whole idea of expressing negative feelings. And a lot of people say, oh, I shouldn't have to do that. Well, you don't. You can express negative feelings in a hostile way and have a big battle on your hands. It's really a choice. But at any rate, I at the beginning of the next session, I just was determined to open up. And I said, Martin, or whatever his name was, could I bring up something that might be a little sensitive or upsetting that's been kind of going on in our sessions? And the idea would be to maybe, if we talk about things we're avoiding, it might deepen our relationship, and that would certainly be cool. And he was just fine with that. And I said, well, you came because your parents said that you don't seem to have any friends, and you're drinking heavily, and you're depressed. And when you come in here, you never do your psychotherapy homework between sessions. And all you do is talk about how you and I are going to go out raping women. And it's very, very disturbing to me. And also, I don't know how often you bathe, Martin, but you nearly always, including today, smell like you're covered with urine. And then the smell lingers for days after the session. And my patients ask, and they're probably wondering if I peed in my pants or whatever. And I just wanted to share that with you, that I've been actually feeling, Martin, wishing every day when your appointment day comes, just wishing that you would drop out of therapy, that you would be a no-show. And then you always show up, and I get disappointed. And then I thought, well, how could there be anything good in this? This sounds horrible. How can my sharing my feelings result in a good outcome? And then I said, but Martin, then something occurred to me. I really like you, and yet I want to get rid of you. And I wonder if that's happening in your other relationships too, that you're interacting with people in maybe a little bit of an insensitive way, and they're not feeling very warm toward you. And so that's all I wanted to tell you, and you can share what some of your feelings might have been as well. And it was pretty simple in a way, but perhaps not straightforward. But he was just fine with it. And then he came in the next week. He was all cleaned up, and he had done his psychotherapy homework, and he became a very pleasant person to work with. But it was, sharing very sensitive, personal, intensely negative feelings in an open, straightforward way, with the idea in mind that the goal is to develop a better relationship with Martin, and not to hurt him or humiliate him or put him down or fire him or something of that nature. So that's about it, for better or worse.
That is just so powerful. And it's just like really super powerful. Exactly what you were saying, Matt, about David, you were being vulnerable about sharing your feelings, and that turned into a really powerful change for him. I'm wondering if the second goal was also for him to have this be brought to light so he could see, well, this is what's happening in your relationship, and you wondered if this was happening in other relationships, which led to what he was suffering from.
Yeah, absolutely.
And it was quite helpful for him, as I recall. He was able to change his life. Is that true?
Yeah, he became a really good patient. We worked together probably another 10 sessions on various things, and he did his homework, and his feelings and thoughts changed, and he was ready to terminate therapy. It's a good outcome.
Yeah.
That's fantastic. And then you mentioned, David, that pretty much everyone struggles with this to some extent, the talking about their own feelings, even if we're not a therapist. And then maybe therapists have some additional reasons why they don't talk about their feelings.
Yeah.
We could bring that to the surface more.
Well, when I was a psychiatric resident, I don't know how it was with you, Matt, or with you, Rhonda, but my supervisors said you're never supposed to share a feeling with a patient. Don't even talk during sessions. And it was this idea that I was supposed to be this blank slate, and they're supposed to project their feelings onto me, I guess. And that was supposed to lead to some insight about what was wrong with them. But it was a very dorky way of treating people. And when I was being supervised by those psychoanalysts, I don't remember anyone ever improving, much less recovering. And when you think about it, we're telling our patients, one of our messages is, I want you to be open and vulnerable, become a genuine human being. Don't go around hiding and being fake all the time. So I want you, Matt, to be genuine and open up with your feelings. But at the same time, I'm going to be hiding mine. And it's just kind of a totally fake and fraudulent relationship.
Exactly. Yeah, it seems like a setup for failure, just from the standpoint that the therapist does have feelings. And if they're thinking they're going to somehow successfully conceal all of their feelings all the time, I don't see how that could actually work. And then if they do express their feelings, it's likely that it would be only after they've built up over a period of time, and they would be more likely to come out sideways as a criticism or a rejection or some kind of demand or something like that. And so not only would it be demoralizing for the therapist, because then they would have failed to do what they thought they were supposed to do, which is to either have no feelings or not to express them. And then it would be demoralizing for the patient too.
Yeah.
To suddenly, out of the blue, have their therapist blow up at them.
Oh, yeah.
I'm wondering about this question, Matt. What are some feelings that the therapist should not express? And I remember you asking me about a patient you were treating. I don't know if she was an attorney or what her profession was. It was a very attractive young woman. And,
oh, right. Yeah.
She kept hanging around your office and after sessions and asking if you would like to walk her to her car and things like this.
Yeah, that created a lot of anxiety for me, and you were super helpful. You said something to me that I'll never forget. Because in one case, I did feel like this attraction to her, and that's a feeling that I wouldn't express to a patient. And you said something like,
"It'd be okay to say I think you're hot" or something like that, wouldn't it?
I think that might be frowned upon by the board, but the thing you said was, just don't pay much attention to it, and it'll go away. That feeling will just go away over time, and it did. I continued to work with her, and she had a fantastic outcome.
Yeah,
and recovered, and eventually my feelings just went away, and that was really helpful for me. Thank you.
When I was starting, go ahead.
I think another feeling is hopelessness or despair. That if the therapist starts to buy into their patient's hopelessness and think that, this is a hopeless patient, they'll never get better, that they need to do some personal work on that feeling or get some help, maybe ask for a consultation or some supervision so that they can get their hope back, because the message of hope is so important when we're working with people.
Well, as the clock in the wall brought us to the end of our I Feel Statements session here.
I think it could. We could have this be a shorter podcast, like the podcast listeners said in our survey that they enjoyed. But can I ask you one more question, actually?
That it's almost over. Yeah.
You feel says.
Yeah.
When you spoke to your patient, David, about your feelings, and you said to him, "I really like you," did you really like him? Because you described yourself.
That's a little advantage that I have, is I generally like most of my patients. Even if I'm getting angry with them, I generally like them. But you don't want to say that if it's not true. But you can say, I want you to know I really like you, but lately I've just been feeling super pissed off at you, and I want to share kind of why that is and what's going on.
Okay, thanks.
I think that's a great question, Rhonda. Yeah.
Okay, so now, Matt, what are you feeling, Matt, as we're ending this podcast?
I'm feeling happy that we talked about this, and sad that we don't have more time to talk about it, but I'm thought we did a great job, and so I'm also feeling proud of us.
I'm feeling angry.
David is pissed.
Kill both of you right after this podcast. Kill.
I'm feeling amused and and grateful that we're not in the same room together, so you actually can't kill us.
Glad we're doing this by Zoom.
Yeah.
Something to look forward to.
Okay, well, thank you so much to all of our listeners, and to you, Matt, and of course, always to you, David. You're the light that shines through all of these podcast episodes.
Thank you. I just love working with both of you, because not only are your brains stellar and just top notch, but your hearts are so tender as well.
Wow. Thank you.
Appreciate that, David. Thank you.
Yeah.
It's been great being on the podcast.
I didn't actually mean it. I was just saying that.
I'll take it. I'll accept it, even if it's not true.
Agreed.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.